This video presents the Femoral, Arterial, and Venous Central Line Simulator developed by the Center for Safety, Simulation, and Advanced Learning Technologies. This simulator was developed using the SMARTS Rapid Simulator Development Platform. The simulator has three major components, including the anatomical block and stand, the computer and screen, and the track tools, which are the ultrasound probe, access needle, and virtual camera controller. A femoral line can be inserted into the simulator. The insertion with or without cognitive aids can be made for both arterial and venous central line placements. In this video, you can see an arterial line with a 7 French Cordis catheter being inserted using the Seldinger technique without the cognitive aids. The Seldinger technique, also known as the Seldinger wire technique, is a medical procedure to obtain safe access to blood vessels and other hollow organs. The desired vessel or cavity is punctured with a sharp, hollow needle. A round-tipped guide wire is then advanced through the lumen of the needle, and the needle is withdrawn. A skin nick is applied with a number 11 scalpel to open up the skin and underlying skin tissue for dilation. A sheath or blunt cannula can now be passed over the guide wire into the cavity or vessel. The Cordis catheter has a dilator already placed inside the catheter, and both are inserted over the guide wire together. The guide wire is withdrawn after passing a sheath or tube. The C-SALT Femoral, Arterial, and Venous Central Line Simulator's anatomical block includes tunnels representing anatomically correct femoral artery and vein. The software has virtual vessels aligned with 3 physical vessels. This provides live visualization as the cognitive aids. Besides the cognitive aids in the software, the instructor and trainee can observe with a borescope the insertion phases in the vessel. There are 3 main methods to differentiate artery and vein in ultrasound examinations at the femoral site. 1. Direct observation of the arterial pulse. 2. Pulsatile color Doppler and pulsatile Doppler vein in artery. And 3. Compression of the vein with direct pressure application using an ultrasound probe. In this simulator, you can use direct observation of the arterial pulse and compression of the vein. In the short axis out-of-plane approach shown here, the long axis of the ultrasound probe is placed perpendicular to the femoral artery, and the needle is observed as a hyperechoic white circular dot on the screen. You can use the tilt, peak, and slide technique to prevent backwalling. The simulation allows inserting a real guide wire and seeing its path inside the vessel, including both the artery and vein, in real time. An actual femoral venous central line catheter can be applied over the guide wire. The software does not track the guide wire or catheter, but provides real-time video as a cognitive aid from the borescope. The simulator allows applying the long axis in-plane approach as well as the short axis out of plane, as shown previously. In this approach, the long axis of the ultrasound probe is placed parallel to the long axis of the femoral artery. If done correctly, the needle appears as a long hyperechoic white object. The anatomical block is made from ballistic gel. This allows for rejuvenating the damage caused by needling and catheter placement in the insertion sites. Heat gun application for a couple of minutes is enough to rejuvenate the simulated skin and prepare the simulator for the next training. Thanks for watching, and contact us with any questions.